Welcome to Comply on the Fly with M3 and Karen B, your trusted resource for quick, reliable insights into employee benefits compliance. Each episode delivers clear answers to common compliance questions. Whether you're tuning in for the first time or you're a seasoned listener, we're here every other week to make navigating compliance a little easier. Please note this podcast and the contents herein do not constitute legal advice. In all cases, employers should consult with their own legal counsel. Let's dive in.
Hello, everyone. I'm Karen B. And the Comply on the Fly topic for today is compliance considerations relevant to moving from a fully insured health plan to self-funding. Often, employers consider self-funding their health plan for a variety of reasons, but it is mostly centered on cost control. What sometimes gets missed in the decision-making process is consideration of the additional compliance obligations that come with sponsoring a self-funded health plan. So here is a high-level overview of some of those compliance considerations. ERISA. When moving from fully insured to self-funded for your health plan, you will need to make sure that the required ERISA documentation, including SPDs or summary plan descriptions, are updated. HIPAA. When an employer sponsors a fully insured health plan, HIPAA compliance is generally handled by the carriers. And carriers are most likely not going to share plan, PHI, or protected health information with the employer plan sponsor. Self-funded health plans are considered covered entities under HIPAA and therefore must directly comply, as the plan sponsor will now have access to PHI. HIPAA compliance is a big undertaking, including adoption of a comprehensive privacy policy, training, performing a risk analysis, and drafting and implementing required policies and procedures. ACA. One obligation under the ACA will be to pay applicable PCORI fees. PCORI stands for Patient-Centered Outcomes Research Institute. These fees would have previously been paid on the employer's behalf by the carrier. These fees are paid based on enrollment numbers and are due every July 31st on IRS Form 720. Another obligation will be to report coverage in Part 3 of the 1095-C forms that the employer submits each year for shared responsibility purposes. Transparency. Self-funded plans generally have greater obligations to meet transparency requirements. This includes submissions for the prescription drug data reporting due every June 1st and the gag clause prohibition attestation. There are additional posting requirements as well. This list is not exhaustive, but meant to give you a high-level overview of some of the compliance obligations that shift to employer plan sponsors when the decision to go self-funded for health coverage is considered or made. As always, M3 Compliance is here to help and can provide a wealth of resources to assist you with these additional compliance obligations. And that is your Comply on the Fly topic for today. Thanks for tuning in.
For more employee benefits compliance insights from Karen B and her team, please visit m3ins.com.